Namaskar, good morning, and welcome to the session on overview of research in naturopathic medicine. Naturopathic medicine is a very old system of medicine, and we have a lot of anecdotes published, and those are being circulated currently as textbooks and reference material. However, since the 19th century documentation is clearly not sufficient as of now, there have been a lot of advances in terms of validating the effects which have been documented centuries ago. And it is not a new system of medicine. However, research in naturopathic medicine is pretty, what to say, new. And we have a fresh generation of researchers today in our webinar who are dedicated to naturopathic medicine research. So once again, welcome all. I am Dr. Dhananjay Arankalle. I'm the moderator for this session, and I have the privilege of introducing two prominent natural researchers. One is Dr. Pradeep Nair, and he's a product of IMC Kanyakumari, one of the pioneers in the field of naturopathy research. He owns an Indian Academy for Scientific Writing and Discovery. Yes, he's actively involved in sharing research knowledge, research methodology among students and clinical practitioners as well. He's worked with the National Institute of Naturopathy for over 5 years, and at various designations. He has experience in heading the research and development department at NIN. He was very much involved in having that department in the first place, and he has over 20 research publications, more than 20 chapters in different textbooks of both national and international systems. He's actively involved in spreading the awareness of the importance of research. He's also a noted speaker in various CMEs and conferences, and he has delivered lectures in various streams of naturopathic medicine. His specific interests are in fasting, gut flora, research methods, biorhythms, and also ozone therapy apart from public health. He's a very dear friend, a colleague, and I welcome you, Dr. Pradeep, as our first panelist, and thank you for sparing some time.
Sure.
So, to begin with, he would be covering a few topics such as certain misconceptions about naturopathy research. There's often questions around what we can do. Another thing is why isn't the common public or even the practitioners for that matter unable to understand at different levels? Then what are the different areas? Which are the different stakeholders that we require to focus on? And how to finally become an effective researcher in naturopathy? And I think he will lead us by example. So once again, welcome, Dr. Pradeep. The next session will be by Dr. Naresh, and once we are done with the first panelist, I'll give a small introduction about a second panelist, who's Dr. Naresh Kumar. So welcome, Dr. Naresh and Dr. Pradeep. And anybody watching this stream is very much
Thank you, Dr. Dhananjay.
you're welcome. You're very much open and welcome to type your questions. We want to make this session as interactive as possible. So I hand over the dais to Dr. Pradeep.
Yeah. Thank you so much, Dhananjay, for that warm welcome. And yeah, Dhananjay himself is a big time researcher and kind of a teacher for me in research, who led me into research, I would say. So rather than wasting time, we'll just get into what we are here for. So as he told, like we'll initially start with the misconceptions of research in naturopathy, especially. So as you see, naturopathy is one of a system which is evolving and which is there. It is usually termed in layman's language as a way of life. So because of that kind of terminology, it is seldom understood the gravity of naturopathy per se, and where we should be looking for um, the kind of evidences which are there for the different kind of therapy or different kind of approaches which we use in naturopathy. So I would like to bring some misconceptions which is prevailing among the practitioners, the students, as well as the common public. The one and the most common misconception we all have is like there is no adequate research in naturopathic medicine. um, to an extent, this is not true. It is a kind of a misconception. There are a lot of research process going on in naturopathy, but however, any system of medicine, research is not something we can just start and end at some point. It is always evolving, and definitely there are a lot of research happening in naturopathy in India and across the globe. And the second misconception we have is like most of the naturopathy practices what we have is based on the anecdotal practices. So we usually say that it is from some traditional practices. We are just taking those concepts or some kind of clinical experience what we have, and we are using that for treating our patients. It is not based on a very scientific or solid methodology that it can be effective across the different strata of the society. So this is one of the another common misconception, and every time whenever we approach with some kind of therapies, we always think that this is from some anecdotal evidence, or there may not be any kind of evidence. Let us take the common example of sun exposure. So sun exposure, if you see, it is one of the very traditional practice in India. Like we all do sun salutations or exposed to sun, and India being a tropical country, sun exposure is one of a kind of a therapeutic regimen. So traditionally, there are a lot of wisdom around sun exposure. But if you think that whether sun exposure is a scientifically driven practice as practiced by naturopaths in India, yes, it is a very scientifically driven practice, but seldom it is confused with a uh, therapy which just have that kind of a anecdotal practice. And another one misconception among all of us, like all of us researchers or students or whoever are the stakeholders for naturopathy, is like research is only possible through the government support, or only government institutes can do research. This is not always true. Definitely we need support from government, or government institutes can do much large scale research, but the basic evidence generation can be very much from the practitioners, clinicians, academicians, and the students. Because like every time government will not be initiating a big project until and unless there is a proof of concept for certain phenomenon. So that can be very much driven from a grassroots level, where every stakeholder of our particular field can be involved. So I'm even including patients into this domain, because you see, there are patient reported outcomes journals where patients can send in their comments, or send in their benefits of how they have been involved. So whoever is passionately involved in naturopathy can contribute back to the naturopathy research. It is not always true that only government can do such kind of research, or research is only possible through government funds or initiatives like that. And another one we commonly see is like naturopathic research can be only done at a therapeutic level. Like we always need some patients, or we always need some disease to do naturopathic research. So this is basically because of the poor understanding about the gravity of naturopathy in terms of what is the broader scope of naturopathy. We have a concept that a medical system per se is just for disease mitigation, and it is not always true that we are just going to do something only in this disease eradication. We have a larger goal in terms of public health expertise, and in terms of empowering agriculture, which will be directly contributing to the health, empowering people to take responsibility for the owners of their health, that can be indirectly contributing to the reducing the disease burden. So such kind of, so it is need not be just therapeutic, like you have to do research, or research should be done on some of the therapies which we are doing. um, so it is not always true. And there is another one bigger problem whenever we speak to some researchers, the pluralistic nature of naturopathy. Like for a single patient or for a multiple patient, we have multiple interventions in place at different point of time. That is because of each intervention is directed with a different intention, to address different kind of nature, different kind of problems. Like we don't look into a disease as a kind of a single centric entity. We have a multifaceted approach when it comes to naturopathy clinical practice, which will be directly reflecting into our research also. So the complexity is our strength, where we can explore a lot about how a complex disease with a multifaceted phenomenon can be approached with a multifaceted approach. The problem is not the system, it is about the exploring different research methods where we can accommodate this complexity or pluralistic therapeutic approach. Like Dr. Naresh will be addressing on that misconception, how we can implement research within this complex city which we have. Okay, so these are the some common misconceptions we have, and if there are any more, you can just add in the comments, which we can discuss at the end of the time. And why we are not able to understand the gravity of research work in naturopathy. So as I told in the first line itself, like we are always saying that there is no adequate research in naturopathy. The problem is not with the number of research papers or number of research which is happening in naturopathy. The problem is with our limited thoughts about the scope and areas of naturopathy. So if you as a physician or a student or a patient who are conventionally trained, or conventionally you look into a health system just for disease mitigation, and for you medical system means a set of therapies and a doctor is giving some therapies. But health per se or disease, evolution of disease is not restricted to your clinic or the number of therapies a doctor is giving to you. When you just look into the overall picture of a disease, there is a social determinant for a disease, an environmental different determinant of a disease, a political determinant of a disease. These are the multiple layer of causation for a particular disease. So when we look for example, if you take diabetes as an example, where you want to see whether naturopathy is effective in diabetes or not, it is not like just you will be looking for some therapies which will be removing your insulin resistance, or which will be reducing your blood sugar level at the end of the day. So naturopathy, the very basic principles, as we say, removing the root cause. So root cause, we as a group of naturopaths or researchers does not believe that the root cause is existing only within the body. It can very well exist outside the body, which can contribute to disease. So our lookout should be, when you look for some research papers on naturopathy or uh, health to through naturopathy for diabetes, you have to look into the environmental determinants, whether our public health uh, expertise can be used to address certain other factors, which not only body is responsible, the whole environment and the community where we belong to is responsible. So likewise, our search strategy should be different, where the scope of our work should be expanding beyond the clinic and the just the textbook references of what we are doing. And we look for any evidences, like if anybody, any student or anybody look for an evidence for some xy condition in naturopathy, we just look with a biomedical understanding of a disease. So, as a naturopath, we are something, biomedical understanding should be there definitely, but that is not the only criteria where you look for a research paper. There is a qualitative approach, how patient feels about your treatment, how the disease came into being in the first place, what are the environmental changes which led to this particular disease in first place, why there is an increased number of cases every year, every year there is an increase in number of cases irrespective of the number of treatments we have. So we should be vigilant about more than the biomedical concept of a research. uh, because we have taken the example of diabetes, we can just take the example of diabetes again. It is not always about insulin resistance or your elevated blood sugar level. It should look beyond, and there are papers, there are evidences supporting such kind of approaches where you look beyond what is just biomedical understanding. So we should be removing those spectacles which we are wearing and looking everything with a biomedical view. And there are different fields where the papers and the evidences which are supporting to the approach with which a holistic naturopathic physician is approaching a particular disease, or health approach. For example, we have anthropology, the field in agriculture, the microbes and the interactions of microbes with the human beings, the causation of industrialization or urbanization, which leads to a different kind of diseases, the trade policies, where as a doctor we have a role, as a researcher we have a role to address all these factors. And and if you see, naturopathy is not just what we do in our clinic, like we just giving a abdominal pack or we are giving some kind of diets. It is expanding in a very different horizon. So if you see every system of medicine or every stream of science, it is all belongs to different discipline of science. So as a researcher, when you look for something in naturopathy, you should start from basic cell research to your therapeutic research. It is like when you give an intervention, how a cell respond to your intervention, and what are the different implication of a cell to different kind of environment which you are providing to the cell. So if we can broader our view with this kind of, like, rather than just looking for some meager symptomatic outcomes, you give a treatment and you get some blood sugar level reduction or some blood pressure reduction, and we are happy with that. So in that way we are limiting ourselves, limiting the scope of doing research in naturopathy without getting into the real cause of a particular problem. And again, when you see, it's a problem with our research training. We want ready-made papers. So if you let's look for diabetes or hypertension or cancer, we want papers which have titled yoga and naturopathy intervention for cancer. To be specific, you want some lung cancer or colon cancer. We want some specific titles for the papers. It is not always we are going to get such kind of papers. Two reasons are there. One thing is like, naturopathy is a very complex phenomenon. Like, there are multiple disciplines involved in a single system of medicine, where you have cell biology, you have biochemistry or microbiology, you have anthropology, which everything is interlinked to each other, and we should look it with a holistic eyes. So our search strategy and difficulty to read in between the lines, you cannot find a paper which is always saying that naturopathy is good for cancer, but you can find a paper which saying that autophagy can remove cancer cells from the body. We have to develop that capacity to read in between the lines, which will make us understand how much evidence based we are. And if you see, appropriate research work can be found by following people who have done substantial work in that field, and also by looking into the different layered mechanisms. So we have a basic philosophy in naturopathy, like unity of disease and unity of cure. So scientifically, if you are just exploring this particular concept of unity of disease and unity of cure, is the unity of disease is the multi-layered and interlinked and interwoven approach of a disease, which can be understood only by looking into what is an epigenetic, how the environment is influencing your cell, how your cell is influencing with the other. It is not what we are seeing as a blood sugar level reduction. Everything is a transient phase. It can be a flight or fight mechanisms also, if the blood sugar elevated biochemical markers. So it is our approach which is a problem, because of which we are not able to find the realistic evidences which is available in naturopathy. And as I told, like, if you just search with the term naturopathy, like I have just done a search today morning, with just naturopathy as your terminology, as your search keyword, you will get only 1356 paper. That is 1356 paper only has naturopathy in its title. Where you just put sun exposure in your search strategy, you are getting 35,000 papers just with the keyword sun exposure. Similarly, I have done a search with hydrotherapy. We have 20,445 papers with hydrotherapy. I have done a combination word diet and gut microbiota. I have got 8,289 papers on diet and gut microbiota. And again, we being a naturopathy researcher, we cannot be just satisfied with hydrotherapy or sun exposure or diet and gut microbiota. Our success will be in implementing all these together and finding the link together for all these. And the current research methodologies what we have will have a limitation, because we can only find one-on-one relation, whether diet is influencing gut microbiota or sun exposure is influencing gut microbiota. So we have to identify different kind of methods where we can implement. So in this current context, we definitely have those kind of evidence which is needed for empowering our clinical practice or advising that this particular intervention is good for that. And Dr. Naresh will be speaking more on what are the different kinds of methods which we can use in naturopathy, and what are the different avenues to be identified. We should be thinking, okay, we have this kind of number of papers, what we should be doing and what we should identify for empowering our research practice. We should follow the public health implications. Like, we cannot just always be in a confident level that we treat lifestyle disorders more often than the other communicable diseases or other kind of diseases we are facing in a society. So we should come out of the comfort zone and look for the public health implications of this naturopathic research. We should, like what in COVID-19 times, what Tamil Nadu has done. They have just gone there and found those randomized control trials which is done on salt water gargling and upper respiratory tract symptoms, and which they have converted into a policy. And being all, of course, there is a political will needed, but there is no dearth of evidence for certain phenomenon. If you just look for even fasting prevents viral replication. There are papers. Sun exposure prevents the um, prevents a number of days the patients want to stay in the hospital. There are evidences available for that. Only thing, as stakeholders, as a patient, as a doctor, as a researcher, as an academician, it is our responsibility to bring this out. We cannot just say that with this keyword I have not got any papers, because and conclude that there is no evidence for naturopathy. And the next one we are very poor is in developing collaborations, establishing connects. We should identify the research groups or authors and establish collaborations. Like, as I told, naturopathy is not just what naturopaths do. There are multiple disciplines involved. There are anthropologists, microbiologists, molecular scientists. We should be establishing connections and contacts. Like, if you just want to look for sun exposure as an example, there is a guy called MF Holly who has done extensive research on sun exposure, vitamin D, and different pathways. So, if you want to get connected and explore such kind of studies, what he has done, there is always a better way to establish those connects. So, we will be exposed to a different stream of research altogether, which will be helping for giving a better outcome for our society. And as I told initially, it is not always government which can do research on for a behalf of a system because of different political reasons. You, as a clinician, as an academician, and even as a student, there is a moral responsibility we can contribute to. Like, there is a constant need for engaging ourselves into research activities, publications. Research means not only just doing a study and getting it published. Even you involved in reading certain kind of research papers which is already being published is very important, because we don't do that kind of reading and we say that we are less evidenced. And exploring the possibilities beyond symptom reduction. So we are just all the studies across the globe, we are majoritarily concentrating on reducing the symptom reduction or managing a disease. Of course that is needed, but when we want to explore more possibilities of what Indian context of naturopathy, that removing the root cause and providing the ultimate freedom from the notion of the disease, we should look for beyond symptom relief. That is what I'm saying. Your research search strategy also should be not just hot water reducing insomnia, hot water reducing congestion. It should not be just that, it should be beyond that. Why congestion in the first place? Then that will enrich and empower our practice, whatever we are doing. And finally, what to do to become an effective researcher in naturopathy. Again, Dhananjay and Naresh will be covering a lot on this. First thing, from my personal experience, what we should be doing is unlearning the way the research is being taught. We should definitely know how research is happening elsewhere in the world, but that is for understanding how not to do research. Because all the research which is taught to us is single entity approach, where you find a single outcome with all the research. So with naturopathy, that kind of scenario won't work. And constant engagement in research related programs and journal clubs. So my life as a researcher started as a CME organized by NIN, where Dhananjay was a resource person. So from there I have never missed any chance to get involved in any kind of research related programs, CMEs, any online programs. It is not about how much you learned, it is about how much you understand what is happening outside. And the third one, philosophically empowering oneself with real potency of the system. So if we are just conventionally or biomedically empowered with what naturopathy is, our research scope will be limited just finding answer for symptoms. When we are philosophically empowered, like unity of disease and unity of cure, and not looking for just symptomatic relief, such kind of concepts, when it is there constantly triggering your mind, we will come up with innovative methodologies which can help uh, our help our research in a better way. And research is not always proving the things in the similar template which is already available. You cannot, you just because RCT is accepted by everyone, we don't have to do randomized control trials for ourselves also. Research is about constant evolution of our thoughts, putting the reality in front. We are always trying to find the reality and the real truth. And just having a post graduation or a PhD will not be just sufficient unless if you have a passion for contributing back to the system. There it will not be sufficing just by having a degree for that matter. And finally, my personal milestones or personal experience with research, which I would always cherish, I just want to share. The one is with the HIV research, which we have done along with NIN, which was initiated by Dr. Babu Joseph, where he established a sanatorium for HIV, which is one of the first kind in India for an infectious disease. We have established a sanatorium, and Dhananjay was the peer seed where he established a kind of a research atmosphere over there. And we have a lot of publications, and we could easily mitigate the sufferings of HIV people, and which we get published in peer reviewed international journal. And the second one, a paper which is recently published on integrating yoga and naturopathy at primary healthcare level. So why I'm just highlighting this particular papers is like, one is as an infectious disease which we all are trying to fight, HIV, as an area where only conventional doctors has a role. It is not definitely, it's only about the time and the approach how we take and give. And the second one is policy level advocacy, like introducing yoga and naturopathy into primary healthcare level. And we had collaborated with molecular biology department of National AIDS Research Institute. And also I always cherish my collaboration with different kind of public health experts like Dhananjay, Naresh, Hindvi, which has empowered the thought as a researcher. So always look for a broader picture. And if you look for a broader picture, there is no other system as evidence like naturopathy, because we contradict. Research is always about evolution, as I told. So happy learning and happy researching. And thank you for the opportunity. Over to Dhananjay.
Thank you, Pradeep, very much for shedding some light and busting certain myths about naturopathy research. So yeah, so it is not only about the keywords which we look at. It may give us misleading numbers. We might miss out, different concepts because we are putting in the wrong keywords. And yeah, so it is all a process which generally comes with experience. It was an interesting thought process which he has put forward in terms of what kind of research a naturopath can undertake. It is not limited to clinical trials. We can basically, document our entire clinical practice case by case, and there are different formats which exist for that. And also there is certain importance that we require to put around the concepts of naturopathy, philosophy of naturopathy. And so yeah, so we require more hands and more brains in this particular field, where we need to explore the philosophies of naturopathy as well. So I had one or two questions for Dr. Pradeep before we proceed to Dr. Naresh, the second panelist. So in your experience, Pradeep, I think it's been over a decade you've been into research. So according to you, I and I'm sure many others would like to know, what is the single most important quality that a researcher should possess, or you would like to rate it as the best
Uh,
quality in a researcher? If you would have to say one out
I
of
would
all
say
the many
I
that
would
we
say
have
reading.
in your
I make sure that I read at least one paper every day. It is not about just learning, like it gives a lot of avenues for you to think in terms of the methodology they are using, and in terms of reading different kind of paper. Like if you want to contradict certain methods, you should know in and out how they have done that methods. So there is no substitute to reading. That is what I feel. And I make sure that I read one paper, and always whoever is associated, I send one paper every day. I don't know whether they are reading or not, but I make sure that I'm doing that for the society. Yeah.
That is excellent. Learning never stops. And reading is actually one of the best ways to keep learning. And we've got a lot of platforms currently available where we can, even get certified, especially in this work from home situation or during this lockdown period as well. Another one that I would like to, ask you for the benefit of everyone, including myself. What do you think is the best way to disseminate information or disseminate evidence as peers among researchers, that is, inter researchers, as well as among students?
Yeah.
So,
So.
of course, publication is one. So, I was not, looking at publications per se, because not everybody has the aptitude or training to interpret research papers.
Mhm.
So, what would you say is the best kind of a method where we can disseminate the findings, because we are, there might be five for every 100 naturopaths out there who would be into research. So
Mhm.
how would you explain the findings to these other 95 practitioners as well as the student population?
So I think here the role of association will come into the picture, where they have a large chunk of or group of people rather than how much we can reach as a researcher. And of course, like when we write for a paper, as you told, it is in a different language, and when we want to disseminate the same knowledge for everyone's benefit, we can definitely convert into a different readable format. Like we always require ready-made solutions for our problems. That associations can disseminate this on a larger platforms. Like now everybody is active in social media, and now we have explored the new fine normal, where we can have live interactions like this on, like people are interested or into different groups of therapies or diseases, where they can select their uh, interest groups based dissemination is also possible. I can't think anything other than that, because like it is available everywhere, research papers or journals, and we all always open to have kind of discussions, or if there is a group to talk and explain what is there. And as you know, like as you are a researcher before me, you know that it is not always the clinicians are very keen to look into those papers, or because they are in their self forte where they are better than anyone else. So always there should be openness in learning. Like we can learn from the clinicians, and clinicians can learn from the researcher. So we should develop such kind of interest groups or close working groups on different area specific, which can be better effective than paper.
Right. So I also feel that there is a lot of scope in terms of when there is a busy practice that is going on. Even if you see for the regular modern medicine, you've got these representatives who come with flip books, and within 2 minutes they showcase the entire life cycle of a particular cell, from how it is manufactured, what are the combinations, what are the different physiological, pathological effects that it can cause within a couple of minutes. So I think there is a good avenue over there if people like you and Naresh can collate that information. That is number one. Number two, to add on to what you said, I think institutes and colleges basically should take this seriously, because if we spare a few thousands of rupees, and we've got more than 40 colleges currently all over India, so that can result into updation of the entire text, and it is basically tap them while they are young. So if you can create a mindset during student life, I think that would stay for a lifetime. So it is an appeal actually to all the institution heads and management heads to basically utilize all these brains and kind of pool in resources and create books, documents, webinars, conferences, and disseminate. So yeah, I agree with what your recommendations are as well. So that is it from my side. Thank you very much, Pradeep, for taking time out and covering quite a lot of in terms of right from the mindset of what is required from the behavior between stakeholders, researchers, and participants in a study, and also what are the common myths and busting those myths. So thanks a lot for having such in-depth discussion today.
Thank you, Dhananjay. Pleasure.
Yeah, sure. Now let's move on to the next panelist, Dr. Naresh Kumar, who is also a BNYS Bachelor's of Naturopathy and Yogic Sciences from JSS Institute. He also has and Yogic Sciences, Coimbatore. He's serving as the assistant professor as well as the research officer for the Department of Community Medicine. He has a specialization in public health, social epidemiology, as is his master's in public health, and nearly a decade of work experience in the field of research, education, and also he has worked with various national and international public health organizations. He has rich community based research experience in project implementations as well. He has a lot of publications to his name, and he's also a qualified NABH Ayush assessor as well. Now, of course, NABH is the QCI accredited body which governs with the hospital standards and quality standards. Recently, in 2020, he was awarded as the best researcher by JSS INYS for his contribution in research. While he has specialized in yoga and naturopathy, his interest primarily lies in health policy research, community mental health, public health policy and implication, community based research, and implementation research. So he's a gem of a person, very down to earth, a very hardworking person, and we are privileged to have him here today to share his experience, his understanding of what basically is required currently in naturopathy research, what are the different types of research, and also a little bit deep dive into qualitative research, and also what are the public health opportunities in terms in the field of naturopathy. So, welcome, Naresh, and thank you for spending so much time today. And I will hand it over to you now. Thanks.
Yeah, thank you, Dhananjay, and thank you, Pradeep. So that was very extensive and very brief talk about the overall aspects of research and naturopathy. Initially, I thought of talking about basics of research, qualitative, and public health, but I'll start now with the question what Dhananjay asked and what Dr. Pradeep has answered. So first is about, so I'll just, it is not, my talk is not about, it's not very structured one. So I'll just talk or discuss about my research experiences in all those fields like basic research, public health, qualitative research and all. So
That
first
will be
question is
great.
about
It
what?
can be very
Yeah,
interactive as well. So thanks.
yeah, that is what. Yeah. So first is about, Pradeep answered about reading. So first and foremost thing about, there is no shortcut to research. So first step to be a researcher is to read a lot. So my experience with students and even my own personal experience as a researcher, I started. with reading. Actually, initially I don't have any reading what to say interest at all, because one paper, if I read one paper, it takes lot of time to understand that basic concepts. That is the initial step. So if you want to understand an paper or a research article, anything, as an initial step, you need to read at least minimum 5 to 6 times for getting a basic understanding. So then you will get into it. So but many students say that it is very difficult to understand. I'll ask, how many times you read? I read once and I read abstract. No, that won't work. I just ask them to read a lot. Read at least minimum 5 to 6 times until you understand some core aspects of research. That is one thing. Another thing about dissemination. So, as a public health researcher who involved in IECs, that is information, education, and communication aspects. So, if you want to disseminate and research, there are two target audience. One is about the person who's already exposed to naturopathy and yoga, like students or co-researchers or our peers, and other is general public. So, as a right way, as Pradeep mentioned, lot of groups, our organization is there to disseminate our research findings or papers to our peer groups. But for general public, the same research paper needs to be targeted in a very simplistic way. Like we can, as Dr. Dandy also said, like we can use some technologies, audio visual aids to disseminate this sort of research findings in a simplistic way. So my basic thing is that, as if I am a good researcher, I want to communicate a particular thing or particular concept to a general person who's not having any knowledge about a topic which I'm talking. So that much simplistic way we have to come down as a researcher. So for that, for example, even my public health research we published, we had a general open meeting where many NGOs came, many people participated, and we just talk. So people will talk, ask us questions in a very simple way. So I wish like naturopathy also will go that level. Why? Because naturopathy started from people, like their practices. So we are just giving a scientific evidence to their practices. So in that way, we need to create an avenues like directly interacting with people and directly taking our research to the people. So I think hope this avenue will be created. Why? Because past decades when I am student, so there are hardly very few people to talk about research, like Dr. Dhananjay, Dr. Raj, or very few people. But now there are a lot of people talking about research, and I'm very happy that many people are doing their PhDs, MDs, their projects, and all. So that is that thing. Then I'll come into the research. So overall research methodology, uh, the research see, to my knowledge, people think that research is like, or many students think that, or even my colleagues and naturopath thinks that research is just giving a treatment, uh, make two separate groups, uh, analyze the findings, and then just project. No, it's not. So once I was surprised actually. I just made a poster like what are the profile of patients who are receiving naturopathy and yoga care. So I just made one chart, and these are the number of patients, these are the diseases, these are for this they are coming, and all those things. Sir, how this is the research or what? That is what I was surprised. This is also a type of research, like profiling a patient, or who utilizes the naturopathy and yoga care, who access the care, what are the issues in accessing naturopathy and yoga care. So this all various avenues are there available. So but people are thinking about clinical lab setup, but I'm not against all those things. But anyway, but now the research is more focused on clinical application based and all those things. But in an closed setup, I wish that this naturopathy and yoga research will come to an open setup, that is community setup. So from there only it will start what to say, expanding the scope of naturopathy and yoga to the common public. So it will start from community based researches. So that is what my first understanding. And then I will come into the topic now. So about overview of research. So if you talk about the utility of research, so how research can be utilized, one is about basic research and second is about applied research. So basic research talks about, as Pradeep already mentioned, it all talks about biological mechanisms, And basic research will help us to expand our knowledge of how a particular physiological mechanism works or treatment works, or how what are the changes happens in that illness or a particular treatment. For example, what happens, what exactly happens to a particular, for example, if you talk about hip bath, so what happens after hip bath? So it all talks about basic research. Okay, so what are the internal organs getting affected? What are the internal organs getting influenced about? So for this having basic research, we can draw the knowledge from already lot of research has been done on this basic sciences about cell biology, cell mechanism, about blood vessels. There are autonomic functions, but there is no ready-made answer for how hip bath works on a particular person. But we need to capture the essence from this basic research. So, and then we have to talk about applied research. That is what we are applying, our therapeutic aspects. So, as a researcher and as an advice to the students, many students, I just ask them to be thorough in some basic concepts of research. So, simple example I can say, for example, Newton's theory. So, what Newton's theory talks about, or Einstein's theory talks about, it's about gravity, space, and all. But lot of current research or a lot of current research in space sciences are based upon their basic theories. So that is what we need to create some basic knowledge about the illness and treatments. So biomedical model talks about microbes or some other risk factors for disease. But so in this current era, in this globalized world, where many our environment is not it's not constant. So if you talk about 20 years before, so we are living in a different world where we are living in a different world where there is no exposure about foreign goods or foreign lifestyle or foreign different cultures and all. But now, so we are practicing and adapting various cultures. So we all, as we naturopathy, it is very clear that our environment influences on our body, but still we are talking about the past, so past environment. but but we can talk about the current socio-economic concepts or socio-political context or current cultural context or current lifestyle practices. There are currently we are living in a different lifestyle practices, but we need to focus on this. As a researcher, I ask or I advise students or co-researchers to focus on what are the current lifestyle practices which is hindering the health of the people. So our shift from lab based to community based starts from here. So from basic timing of eating. So we all have some research which has happened in Western world and all, but Indian culture, Indian practices, and Indian what to say, Indian lifestyle, it's totally changed. For example, a simple example is it may be very odd, but our what to say, attending a natural call, timing, and use of Western toilets and Indian type of toilets. We talk about the what to say, proper way of sitting, squatting positions. So there is a total change from even toilet practices from basic Indian style to Western style. So then it can be correlated. We can talk about correlation research. It can be correlated with a lot of constipation issues and all those things. So this one example I'm saying. That's what. So what is current problems going on in the community? So what are the current lifestyles? We need to correlate it. So for that we can have some sort of various research designs. We can have cohort studies or case control studies. That many designs we can adapt. So that is one thing. One is about basic research. There are a lot of basic research available. So we need to fit in or take the extract of that, and we have to apply it with our naturopathy, and then we have to proceed from that one. So that is about one thing. And then another important thing I thought of, there are a lot of research about observational studies, cohort studies, experimental studies. And another one important aspect of research we are missing in terms of, you talk about public health aspect, is about cost effective analysis. Like if you talk about cost economy, everything has economy involved in it. So whatever practices, whatever system, but what I feel is that there is very least economic evaluation studies in our system or in our country related to, even if you talk about general Ayush system itself, there is very less economic evaluation about it, like cost analysis, cost effective analysis, cost minimizing analysis, cost benefit analysis, how cost effectiveness, so how people spend effectively their money, whether they are spending in the for changing their behavior or changing their or taking secondary care or taking tertiary care. So these all economic evaluations related to naturopathy and yoga is very, very important. So this basic, this also helps the future researchers or future naturopathy practitioners to practice in the field, what is currently happening in the field, what, how much people spend on healthcare, so how much people spend on Ayush care, how much people spend on homeopathy care. So these all the research focus we should have. So this for doing these researches, there are a lot of research methodologies has been involved. So that is altogether it's a total different topic, what are the various research methodologies. So there are a lot of, if you talk about epidemiology, we talk about what to say, observation studies. In observation studies, we talk about descriptive analytical studies, or next about experimental studies. So each have its own pros and cons. And for naturopathy, we need to build upon these methodologies. There is no fixed methodology that we should follow, actually, up to my knowledge. So there are, we can mix the methodologies. We can, even in research philosophy, we call it as pragmatic research design, or a pragmatic research approach, where we can mix different methods, qualitative, quantitative approaches, to do or to understand the nature of naturopathy and yoga. This is about overall research, and mainly we talk about that's what, up to my knowledge. And again, this is policy analysis. We talk about there is no regulation. We talk about there are a lot of politics involved, but up to my knowledge, there are a lot of policy analysis paper and the struggles of naturopathy and yoga practitioners even in Western world. But in India, we struggle a lot. But I'm trying to write on paper on that one. So what are the problems related to from policy lens? I'm not talking about individual lens, from a national policy lens. So where we stand as a naturopathy and yoga physician. So that sort of research approach is lacking, what I feel. So then talk about qualitative and quantitative aspects of research. So most of the treatment effectiveness in naturopathy and yoga are quantified. So 90% of the paper, or even 95% of paper, we can say whether this treatment is effective for this, or cause and effect relationship is all quantified. But there is a different, equal to quantitative, there is another paradigm called qualitative research. So qualitative research will not talk about effectiveness of treatment, but about people's perceived world. So quantitative talks about real nature of world, what is there, whether A will have impact on B. That's it. That will finish. There are some limitations of quantitative research also, but qualitative research talks about, okay, so whether A has an impact on B, okay, fine, it is having impact. But what and all the ways during the pathway, how people felt about the changes, everything will be qualified, or we can say as an subjectified. So quantitative talks about objective aspects, and qualitative talks about subjective aspects of research. So if you talk about qualitative methods, we can use it for even Pradeep also touched about that qualitative methods. So we can have one basic understanding of why patients seek naturopathy and yoga care. I'm all talking about and public health overview. So why I'm talking about public health overview is that until unless we reach mass, or we reach a general public without any hindrance. Why allopathy is very success? Because irrespective of caste, creed, economic aspects, everything, so it addressed need of every people. Right now there are a lot of commercialization aspects of allopathy system, but anyway, but from even poor people use allopathy. So which in previous days it was not so. So like that, even when poor people should use naturopathy, and we should focus on that aspects, like equality of naturopathy and yoga spread in among Indian communities. So for that we need more qualitative aspects. So like understanding the types of patients who access naturopathy and yoga care. So in what circumstances people live, whether they can able to follow, because if you talk about inpatients and outpatient settings, So inpatients, okay, fine, they'll come here, experience the treatment and go. Outpatients, we ask them to avoid some lifestyle practices. So we ask them to follow one particular lifestyle, but we totally forget about the social determinants of the health, what we call. So because nearly 90% of his health is determined by the society where he lives. If we ask him to go and eat this particular diet, if the whole family is eating other diet, so definitely he can't able to follow the same pattern. So we have to get into that family. So what are the possible mechanisms, possible changes we can make to that family? So that is what naturopathy. We may talk about individual care, but up to my knowledge, without addressing social determinants of his lifestyle or his health, taking naturopathy and yoga research to the whole mass or whole community people is very difficult. So for understanding that aspect, social determinants of understanding or utilizing naturopathy and yoga care is an important avenue to look into. And then about how treatment works. So one is about we can measure the blood pressure, autonomic system, or nervous system, and all those things. Other thing is that how people feel, perception about the people. It can be only captured through qualitative. Okay, so we can have a quality of life questionnaire, but quality of life questionnaire is a structured one. So there are a lot of because every subject is different, because he is coming from a different community setting. So his perception about the naturopathy treatment will be different from another person who is coming from urban areas, rural areas. So this divide and this understanding is very much important. And about what about their illness, if you talk about there are different health belief models, health seeking care models which is available. So we can utilize that model to understand how people feel. For example, perceived belief, perceived people's perceived illness, perceived risk, all influences the person to take different decisions to take uh, to access a naturopathy and yoga care. So we need to focus on that aspects of research too. And about lastly, we talk about public health aspects of research. So again, as I already, most of the research are focused on clinical and experimental medicine, but we totally neglect the public health dimensions of research, that is about their social, cultural, political, economic context. So if you study all those things about in which society they live, what culture they practice, in that culture, whether we can able to impart naturopathy and yoga care or naturopathy and yoga lifestyle, and also their economic factors, like because there are many colleagues who say that naturopathy and yoga is a costly treatment. So only people with money who can come here and take treatments. But it's not so. So because, for example, in Tamil Nadu, there are lakhs of people accessing naturopathy and yoga care, which is public funded. So our focus should be on making an naturopathy and yoga as an integrated system of medicine into a public health system. So where it is funded, even availability of insurance coverage also influences on naturopathy and yoga care. So right now there are only few insurance companies providing naturopathy and yoga care, or covering the cost of naturopathy and yoga treatment, that to one particular extent. But if we focus on this for improving the utilization or improving the access of naturopathy and yoga care, like insurance coverages or economic evaluations, definitely will take naturopathy and yoga treatment to many number of people. So another thing is about policy regulations. So even so, our main focus should be on policy regulations, especially naturopathy and yoga education and naturopathy yoga practices. So about safety, efficacy, and quality of naturopathy and yoga care. So for that, what I'm talking about is all now currently evolving in Western world actually. So that we also focus on. So we can focus on about the quality, safety, efficacy. So these are all the basic aspects. If I talk about naturopathy and yoga safety papers, there's very few papers, hardly I can say one or two papers about safety, efficacy, and quality. There the naturopathy and yoga care is provided in same quality with different people. I know there are limitations, because it depends upon providers, it depends upon the people, it depends upon the disease, it depends upon the age, everything. But there should be some quality standards. It needs a lot of thought into it. So how to make an overall quality of an naturopathy and yoga treatment, even protocol generation and all those things. And we talk about access. So there is very less data about access, who access naturopathy and yoga care. Even there are some clinical records, hospital records, but many hospitals, there are many successful hospitals which are located in different contexts, different state, whether rural, urban. But we need to collect all those data, whether in particular culture, particular state, or particular rural area, what type of patients are coming. In urban settings, what type of patients are coming. So what about the cost? So what about their what about their impact on this cost? And all those things we need to look into. And again, another thing is about rational use of naturopathy in yoga care, whether all people are using it rationally. So I just started to take into note about what are the different uh, naturopathy persons, or naturopathy people, or yoga people, or what we can say it as unqualified people. What are the different types of people? What are the different types of universities providing that care? So I'm just looking into that aspects. So that also will help us to make naturopathy and yoga research as an rational way of utilizing the care. So up to this, I'm just ending up my thing because it has took time. Um, Again, what about, I want to talk about another important one last point, is that about research in behavioral change. So behavioral change, because naturopathy and yoga, we talks about lifestyle and behavior. So it is very difficult to, there are a lot of courses, lot of papers, a lot of psychological research available on this behavioral change. As a naturopathy and yoga practitioners, we need to focus on this behavioral change, because behavioral change will not come in single day. So we all know that smoking is injurious to health, but many people are smoking. So why? What is their behavior? It is very difficult to change the behavior of a particular person until unless it impacts some other emotional aspects of his life. So if you want to focus on, or if you want to expand the scope of naturopathy and yoga, so we need to focus on behavioral research of, or the behavioral aspects of naturopathy and yoga. Okay, thank you. And again, there is no shortcut to research. So read a lot. So if you start reading, initially it may be, if you feel like it is difficult, but once if you get into that, taste the honey or taste the nectar of that reading aspects, reading habit, so you love to do research. That is what my final concluding thing. So any questions you can take, or that's it. Thank you, Dhananjay. I'm ending up my session.
Thank you very much, Naresh. You've brought out, the three key aspects in health services research. Basically, the quality of care, the access to healthcare, and also the cost involved. So these three are, I think, primary to health services research. And along with modern medicine, naturopathy is also, one of the services that we are providing to the needy. You also pointed out, certain important factors such as having, insurance companies, so that it is more accessible to the general public. And I think there are a few, such as ICICI Lombard, you've got HDFC Ergo, who are now covering the entire Ayush in their treatments as well. But of course, it is not as we would want it at this stage. But it is a very good initiative. Another thing which you have pointed out in health research, in health services research, is the longevity. I think it is very important to understand that health services research, as Naresh has pointed out, it is very, very vital for the society. In 1930s, and compared to the current decade, we have increased the lifespan on an average of 30 years. And from 1950s we have increased it to 20 years. And one of the most important research that is currently going on is, the top notch research is by the National Institute of Aging, which comes under the US, NIH, National Institutes of Health. And they have determined that fasting, in different forms, is the single most non-invasive and effective method to prevent aging, and it can also have a lot of beneficial effects on the cognitive functions which decline with age, and also a lot of internal physiological changes as well. So a lot of good lies in undertaking health services research, and that is generally what our focus as naturopaths should be in the next decade or so. Of course, we should have a new a new set of brains who should start working on health services research, and few of them continuing on the basic and applied research aspect as well. So thank you, Naresh, for bringing out the importance of qualitative research, the social dimensions of health, and how the environmental factors, the economic conditions, where the person actually stays, the family factor, the upbringing, and all of these are so vital in having a healthy life of a person. So more than, and naturopathy focuses more than on the disease aspect. It focuses more on the health aspect, and that is why it is naturopathy is so very much relevant in public health, because it is again a health service that we are providing, not a symptomatic or disease kind of a treatment which we are providing. So thank you. I think we've just covered over an hour. We've tried our best, and
Yeah.
any questions that anybody has, they can post it on the stream, which will be live. And once it is aired on the Enigma as well as the Ayush Connect, also we can post our responses over there as well. So thank you to both the panelists, Dr. Naresh and Dr. Pradeep, for spending some time. I would like to call out Health Inc. and Ayush Connect, as well as Enigma Central, for giving us this opportunity, to share our expertise and ideas. So thank you, Health Inc. Thank you, Ayush Connect. Thank you very much to Dr. Rajesh from Enigma Central, and thank you, Dr. Pradeep, Dr. Naresh, and happy
Thank you.
Ganesh Chaturthi to all the listeners. Thank you very much. So we would like to
Thank you.
end the session.
Thank you. Thank you, Dhananjay.
You have been a wonderful.
Yeah.
Thank you.
Thank you, Pradeep. Thank you, Dhananjay.